Unit 10 Gastrointestinal System Questions. 1. Sulfasalazine is prescribed for the client with a diagnosis of ulcerative colitis, and the nurse instructs the client about the medication. Which statement made by the client indicates a need for further instructions? 1. Sensitivity to sunlight may occur. 2. I need to take the medication with meals. 3. I should take this medication as prescribed. 4. The medication will cause constipation. The correct answer is 4. The medication will cause constipation. A client with liver disease has a dietary protein restriction. The nurse encourages intake of which of the following complete proteins to maximize the availability of essential amino acids? 1. Meats. 2. Vegetables. 3. Cereals. 4. Nuts. The correct answer is 1. Meats. A nurse is reviewing laboratory test results for the client with liver disease and notes that the client's albumin level is low. The nurse next assesses the client for which of the following physiological effects of decreased circulating albumin? 1. Cerebral edema. 2. Peripheral edema. 3. Reflexive increase in total protein level. 4. Decreased clotting availability. The correct answer is 2. Peripheral edema. A client with liver dysfunction is having difficulty with protein metabolism. The nurse anticipates that the results of which of the following serum laboratory studies will be elevated? 1. Lactic acid. 2. Ammonia. 3. Albumin. 4. Lactase. The correct answer is 2. Ammonia. A client is admitted to the hospital following extreme dieting with severe weight loss. The nurse attributes the weight loss to which of the following physiological processes that occurs in the prolonged absence of adequate food intake? 1. Glucose metabolism. 2. Glycogenolysis. 3. Gluconeogenesis. 4. Lactic acidosis. The correct answer is 3. Gluconeogenesis. The nurse is providing the client with biliary obstruction, a simple overview of the anatomy of the liver and gallbladder. The nurse tells the client that normally the liver stores bile in the gallbladder, which is connected to the liver by the 1. Liver canaliculi. 2. Common bile duct. 3. Cystic duct. 4. Right hepatic duct. The correct answer is 3. Cystic duct. The client with cirrhosis has ascites and excess fluid volume. Which measure will the nurse include in the plan of care for this client? 1. Increase the amount of sodium in the diet. 2. Limit the amount of fluids consumed. 3. Encourage frequent ambulation. 4. Administer magnesium and acids. The correct answer is 2. Limit the amount of fluids consumed. A client with liver dysfunction has low serum levels of thrombin. The nurse provides care anticipating that this client is most at risk of 1. Dehydration. 2. Malnutrition. 3. Bleeding. 4. Infection. The correct answer is 3. Bleeding. A physician is about to perform a paracentesis on a client with abdominal ascites. The nurse would assist the client to assume which of the following positions? 1. Upright. 2. Supine. 3. Right side lying. 4. Left side lying. The correct answer is 1. Upright. A client has been advanced to a solid diet following subtotal gastrectomy. A nurse caring for the client would do which of the following to minimize the risk of dumping syndrome? 1. Remove fluids from the meal tray. 2. Ask the client to sit up for an hour after eating. 3. Provide concentrated high carbohydrated foods. 4. Give the client 2 large meals per day. The correct answer is 1. Remove fluids from the meal tray.